In Ayurveda, three vital points known as Trimarma are considered essential for maintaining life: the head, the heart, and the bladder. When the bladder is affected, it can lead to condition characterized by symptoms such as Prabhuda Mutrata, excess urination, and Avila Mutrata, which is turbid urination. This is Prameha in Ayurveda, which closely correlate with diabetes mellitus in modern medicine. Namaste. Welcome to today's session. In this video, we will explore Prameha in detail, its causes, symptoms, and Ayurvedic understanding. We will also discuss its management through Ayurvedic treatments including diet, lifestyle, and specific yogasanas that can help controlling diabetes and improve overall quality of life. Let's begin. According to Charaka Sutrasthana, Prameha is characterized as a Sandarpanajanya Vyadhi, which means disease caused due to overnourishment or excessive intake of heavy and unctuous food along with sedentary lifestyle. Because of this, Kapha dosha gets aggravated with Medo Dhatu leading to imbalance in body's metabolism. So even though three doshas are involved, Kapha dosha is predominant in pathology. It is also classified as one among the Ashtamahagada, which are 8 major and serious diseases according to Ayurveda. Now, coming to the types of Prameha, let's break it down in a simple way. First, there are two primary types. One is Sahaja Prameha. This type is present from birth or it is hereditary or congenital in nature. Second is Apatya Nimittaja, develops due to improper diet and lifestyle habits. For example, excess intake of sugar and lack of physical activity. Now, there is another important classification based on body types. First one is Sthula Pramehi, means obese patients or of diabetes. These are usually associated with kapha dominance and lifestyle factors. The second is Krisha Pramehi. Krisha means lean. These individuals are thin or underweight and their condition is comparatively difficult to manage. Now, Prameha is divided into three types based on dosha predominance: Kaphaja, Pittaja, and Vataja Prameha. Among these, Kaphaja Prameha is considered as Sadhya, which means curable. Pittaja is Yapya or managed with difficulty, and Vadaja Prameha is considered as Asadhya, which means incurable. To make this easy, let's relate to modern examples. For Sadhya conditions, you can think of something like gestational diabetes. After pregnancy, blood sugar level often returns to normal, and medications may no longer be needed. For Yapya conditions, take type 2 diabetes mellitus associated with obesity. It can be controlled with diet, lifestyle, and medicine, but requires continuous management. And for Asadhya type, consider hereditary or congenital diabetes mellitus like type 1, where the person is insulin dependent. Now, let's see the 20 types of Prameha. It can be broadly divided into three categories based on doshas. First, we have Vataja Prameha, which consists of 4 types. Next is Pittaja Prameha, which includes 6 types. And finally, we have Kabaja Prameha, which is the largest group consisting of 10 types. You can pause this part of video to take notes of the different types or take a screenshot of it. Now, let's move on to Nidana, which means the causative factors of the disease. This reference is taken from Charaka Chikitsa. This reference can be broadly classified into 3 main categories: diet-related causes, lifestyle factors, and psychological factors. Starting with diet-related causes, main contributions include excess intake of curd, consumption of flesh from water-dwelling animals or animals living near water bodies, and excessive intake of jaggery or sugar. Next, coming to lifestyle factors, also known as vihara. The first is a sedentary lifestyle, that is lack of physical activities, and second is excessive sleep. Finally, we have psychological factors or manasika nidana. These include anxiety, overthinking, excess stress or strain, avoidance of mental activities, and lack of mental exercises. Let's look into the pathogenesis, that is the Samanya Samprapti of Prameha. This reference is taken from Charaka Chikitsa 6th chapter. We will study it step by step. So, how does the disease actually develop? Due to etiological factors or nidana, there will be increase of kleda or liquid part in the body. Because of this, there is also an accumulation of kapha dosha, along with pitta and an increase in medas and mamsa dhadus. As these factors accumulate over time, they lead to obstruction of normal pathways of vata. This condition is known as avrita vata. Now, this obstructed vata starts carrying the essence of body tissues, that is dhadus, especially ojas, towards the basti or the urinary bladder or lower abdomen region. As a result of this process, two important features are produced, which are also the symptoms of the disease. First one, Prabudha Mutrada, excess quantity of urine. Second one is Avila Mutrada, increase in turbidity of urine. Ultimately, this leads to Mehan Janayat Yadaswam, the disease state of Prameha. This is how Prameha happens. Premonitory symptoms of Prameha or Purvarupa. Here is the reference. The symptoms include excessive sweating, excessive desire for comfort, lying down, sitting, or sleeping. Shayasana Sopna Sukhe. Stickiness or coating in heart region, heaviness in heart region, eyes, tongues, and ears. Excessive growth of hair and nails. Preference for cold things. Dryness of throat and palate. Sweet taste in the mouth. Madhurya Asye. Burning sensation in hands and feet. Karapada Daha. Let's try to understand the two main symptoms in modern medical terminology. The first one is Prabudha Mutrada, which is passing urine in excess quantity. In modern terms, this can be closely correlated with polyuria. The second symptom is Avila Mutrada, which refers to turbid or cloudy urine. In modern understanding, this can correspond to glycosuria, which is the presence of sugar in urine. Proteinuria means protein in urine, and even the presence of lipid content or other suspended particles in urine can also be traced. Looking into the most important part, Chikitsa or treatment of Prameha. The reference is also taken from Charaka Chikitsa, and we can understand this sloka in a simplified way. There are mainly two streams of treatment approach. The first is for Stula Pramehi, which can be correlated with obese diabetes mellitus. In this case, we directly go for Shodhana, which is elimination or purification therapy. This is then followed by Sandarpana or nourishing therapy, depending on the digestive power of the individual. Now, why do we include nourishing therapy after elimination? Because excessive avatarpana or overdoing elimination therapies can lead to complications like gulma, mehana basti shula, pain in the bladder and genital region, and mutrakada, retention of urine. Coming to the second approach, this is for Krisha Pramehi, which can be correlated with lean diabetes mellitus. Here, we mainly focus on Sandarpana, that is nourishing therapy, along with Shamana or palliative treatment. So, overall, the line of management depends on proper assessment of the patient, including Prakriti, Vikriti, and Samprapti Ghadaka, before deciding the treatment. There are also some specific therapies mentioned. For Pittaja Prameha, we go for Virechana or purgation therapy. For Kaphaja Prameha, Vamana or emesis therapy is indicated, and Vataja Prameha is generally considered more challenging to treat. So, this is the overall approach to Chikitsa of Prameha according to Charaka. Let's look at some medicine options, which include Nishamalakati Kashaya, Chandraprabhavati, Triphala Churna, Shila Jadu, Vasanta Kusumara Rasa, Darvyadi Kwada, Nisha Kadakati Kashaya, Jambu Asava. Also, there are single drugs which can be used such as Guduchi, Neem, Amalaki, Haridra, Meshashringi, Jambu. Now let's look at the diet and lifestyle recommendations, that is the Pathya and Abhatya for a person with Prameha or diabetes mellitus. Starting with Pathya or the do's in diet, foods that are beneficial include barley, bitter gourd, honey, soft bamboo, old wheat grain, palm fruit, garlic, jambu, green gram, buttermilk and ragi. These foods help in maintaining proper metabolism and balancing the doshas. Now coming to Abhatya or the don'ts. Patients should avoid excess intake of curd, sweets and sugary foods, and meat of aquatic animals. These dietary factors can aggravate the condition and should be restricted. Now let's move on to the lifestyle recommendations, that is the Pathya and Abhatya in terms of daily habits. Starting with the do's. Regular exercise is very important, along with walking as a simple and effective daily activity, and controlled fasting wherever appropriate and advised. This helps in improving metabolism and maintaining balance in the body. Let's look into the don'ts. Avoid suppression of natural urges, especially the urge to urinate. Avoid smoking, avoid excessive fermentation, and also avoid unnecessary bloodletting procedures unless specifically indicated. In addition, a sedentary lifestyle should be strictly avoided, and daytime sleep is also not recommended. To the last part of this video, yoga and pranayama advised in Prameha. Some of the most important asanas which are shown here include Maltsyasana, Vakrasana, Ushtrasana, Shirshasana and Mayurasana. Along with regular practice of pranayama, All these practices play a supportive role in managing the condition. Overall, these asanas and pranayama help to improve the body's metabolism and enhance the efficiency of body cells in utilizing insulin from the blood. As a result, they help in better regulation of blood sugar levels. Thank you so much for watching the video, and I hope you have learned something new and interesting today. Like, comment and subscribe this video and share it with your friends. Leave a question in the comment section if you have any doubts.